Another topic that I encounter with my patients and see often is the development of a blood clot, or something we call DVT, which stands for deep venous thrombosis. It's a blood clot that forms in the veins, typically of the legs, but it can happen in the arteries. Problem is because if you have a large blood clot in your leg, possibly arm, it could break free, get into the circulatory system, and end up clogging the circulation of the lungs, something we call pulmonary embolism. If you're blocking blood flow to the lungs, the lung tissue can die and a person can die. So a very serious condition. Typically, the most common scenario is a patient comes to me and says, hey, you know what, my leg is swollen. It's usually one leg, not both. Sometimes it can be two. And it's usually disproportionately swollen more than the other leg. And so when a physician checks it, it's 3 times bigger. It's pitting edema, meaning you push on the leg and it's like pushing on dough, it leaves a dent. That's a very large suspicion for blood clot. Oftentimes, prolonged travel sitting in the same position, maybe a long airplane ride without the ability to ambulate or stretch your legs can potentiate the formation of a blood clot. So travel is one. Another one is a hypercoagulable state. Some patients have a genetic predisposition to form blood clots, and those patients in particular need to be on long-term anticoagulation. That's checked through blood work. Other things that cause blood clots is people with cancers. Cancers, for whatever reason, form people to form blood clots. So when a person has a cancer, they have a swollen extremity or feeling extremely short of breath, we need to look for a DVT and or a pulmonary embolism. Interesting, in the last few years, COVID has caused blood clot formations and pulmonary embolisms through a hypercoagulable state also. So let's just say you have a blood clot, doc. Yeah, we got a blood clot there. What do? We usually treat it with anticoagulation, a blood thinner. Maybe you've heard of them, the brand name Eliquis, Xarelto, things of that nature. And we typically treat it for up to 3 to 4 months, depending on the type of DVT or blood clot. So what do I mean by that? So there's a provoked DVT and an unprovoked. Provoked means like, yeah, I took a trip for many, many hours, and so we provoked a DVT. Or maybe I had a surgery, an orthopedic surgery, and that provoked a deep venous thrombosis. So those we typically anticoagulate, and after a particular amount of time, we stop the anticoagulation. Now, if they have an unprovoked DVT, meaning there's no history of travel, they just woke up with this, and their workup for family history of blood clots is positive, typically those patients need lifelong anticoagulation.